Okay, great. Thank you.
All right, Congressman Banks, thanks for talking with me this morning. President Trump sending out warnings, demanding a vote today from House lawmakers on the GOP health care plan after yesterday's vote was called off. Some Republicans are still saying that they are going to vote against the bill because they say it's going to hurt their constituents. Where do you stand on this and why?
I intend to vote for the bill if we vote on it today, which I hope that we will. I believe that this bill, the American Health Care Act, is far substantially better than what we have under Obamacare today. Yesterday evening, we heard from a representative of the president who appeared before the Republican conference meeting with a message from the president. There were three prongs to his message. First of all, the president said that he's done negotiating with members of Congress. He's met with over 100 of us who have met with him in the Oval Office to talk about ways that the bill can be improved or concerns about the bill, but he wanted to let us know that he's done negotiating. Secondly, on behalf of the American people, the president called for us to take a vote on the bill. We were scheduled to vote on it yesterday, but they still didn't have the full number of votes that they needed to pass the bill out of the House of Representatives. The president, on behalf of the American people, called on us to vote on the bill, whether it passes or not, to let the American people know that we are taking the commitment seriously to repeal Obamacare. Then the third aspect of his message was very important as well. That message was that the president wanted us to know that if the bill doesn't pass, he's moving on to other issues like priorities like tax reform, building the wall, rebuilding the military. What that means and why it's so important is that if we don't pass this bill, that means that we will be stuck with Obamacare well into the future. I don't think that's good enough. I'm one who readily admits that the bill that we're voting on today is not 100% of what I want, but it does go a great deal further to repealing Obamacare and replacing it with a system that I believe will work for more Americans than what we have under Obamacare, which is literally collapsing in on itself today.
Now, according to the Congressional Budget Office, they estimate that 14 million people are going to become uninsured next year if this plan is signed. What medical coverage options would these millions of people then have?
Well, they would have a great deal of options. What this bill would do is significantly that it would block grant Medicaid funds to the states. I believe that's a very good change that was made to the bill after I met with the president last Friday that would allow states like Indiana to preserve and protect programs like HIP 2.0. So what it would also do is it would create a refundable tax credit for individuals who purchase their health insurance who don't receive health insurance from their employer. It would also give health savings account options to Americans as well who purchase their own insurance. Overall, I believe that what this bill will do is it will create more competition. It will drive down the cost of premiums and create more options for the American people to purchase their health insurance. There is much to like about this bill. I readily admit that I don't believe it goes far enough to repeal the regulatory framework of Obamacare, but I hope that we can tackle some of the issues that are left in the months and years to come in other ways.
Now, if this bill doesn't pass and Obamacare remains intact, will that cripple the Republican agenda?
It could. That's a fair point that the president and others have made. We have a number of very key issues that we need to take up in this Congress, like tax reform, like securing our borders and rebuilding our military. That is what I'm most focused on in this Congress as a member of the House Armed Services Committee. We have a lot of work to do. This was the first big issue that we've taken on as a Republican Party, the first big issue on behalf of the administration. And I believe it's an important one. What we have in America is a mess left with Obamacare, with most Americans paying substantially more for their health insurance premiums than what they were paying before, with less options for health care. And I believe that that's why this bill is important today to address those issues. I hope that we can get to a vote and pass it. But when we do pass it, the issue isn't done. It still goes to the Senate. The Senate will then take up the issue, and they will make changes as well before we would vote on it again in a conference report after the Senate passes it as well. So this issue still has a long ways to go.
Right. Let's go back to HIP 2.0 for a moment, specifically as it relates to Indiana. There is concern, particularly among Democrats, the plan is going to reverse the impacts of HIP 2.0 and cause some negative impacts on Medicaid and drug treatment programs by reducing federal funding. Do you think there is any merit to that concern?
Not at all. In fact, that's why Governor Holcomb came out yesterday in favor of the American Health Care Act, the bill that we will be voting on today, because what it does is gives the state more flexibility to govern and run these programs on their own, as well as the block grant option that states like Indiana would have. What Governor Holcomb and so many other governors around the country, including Democrat governors, tell us on a regular basis is that they can do more with less money if they get rid of the red tape and bureaucracy that the federal government creates in administering these programs if we let the states administer the programs instead. So I believe that Indiana and HIP 2.0 would be much better off if we pass the American Health Care Act and give the states that flexibility to govern and administer these programs on their own.
I know our window of time is closing. According to your website, you're going to have a staff member in Woodburn Tuesday, March 28th, holding office hours, and your constituents are invited to stop by. Is there anything in particular on the agenda?
You mean for those office hours? My
Yes.
staff has undertaken an aggressive approach to visiting with constituents around the district. Every day, I have a member of my staff holding office hours in every community in the district. I'm very proud of that initiative on behalf of my team. Because I'm in Washington, D.C., I can't be in the district every day, so my staff is able to go out and visit with constituents and relay to me their important concerns or issues, and as well as take care of a number of personal issues on behalf of our constituents. Our staff takes care of casework for veterans, for other constituents who have issues with the federal government. That's a big part of what we do, and the office hours in Woodburn are just like the office hours that we hold in every other community in the district to allow our constituents to provide input and also to address personal issues that they might have as well.
Congressman Banks, thank you for your time. I know you have a very busy day today.
Thank you very much. Have a good day.
You too. Thank you.